thank you so much for joining us today. And
thank you so much. I really appreciate the opportunity to be here. So good morning to everyone, and possibly heading into the afternoon. As Dan said, my name is Bobby Jo Massey. I am the National Sales Account Executive here at United Healthcare. And I'm glad to be part of your day today. Unfortunately, I don't have a colleague with me today who usually helps to manage the chat function, and I'm not a good multitasker. So please do feel free to utilize the chat box, and hopefully I can address those at the end. As far as the questions that I typically get, it's right now around commissions and heat maps. None of that is available this far. It should be coming in a few weeks, so stay tuned for that. But let's get started. Let's talk about United Healthcare individual and family plans for 2024. Our agenda today, we'll go over our 2024 market overview, including the 4 new state entries, our network strategy. We'll go through the product offering, our national marketing strategy, and then agent tools. These are designed to help you not only sell our individual and family plans, but also to assist your clients every step of the way. And finally, we'll go over our ancillary products. I know Nick kind of touched on that as well. We'll go over our ancillary products to provide you an avenue to another income stream as a way to better protect your clients. So let's get started and diving into our market overview. As you all know, possibly, in 2021, we came back into the ACA space in required markets and markets where we were positioned for success. In 2022, we added 7 additional states. 2023, we added 4 states, and then as you look at the bottom right, you'll see in 2024, we are entering 4 more new states and greatly expanding our footprint, reaching 50% of all IFP lives nationally. With increased government support of ACA and stability in the space, we can proudly say we are here for good. Just focusing on 2024, as I said, we're entering 4 new states. Those are the ones that you see here in that yellow, which is South Carolina, New Mexico, New Jersey, and Wisconsin, with a large rural expansion happening in Texas, Florida, and some other additional states. In 2024, our footprint, you'll see the bottom right, will grow from 90 markets across 19 states to 138 markets across 23 states. We're also doubling in our counties. As you can see, in 2023, we were in 532 counties, and we are going to be over 1,000 counties for 2024. So I'm really excited for this year. Touching on our network, as I already mentioned, for 2024, those new states that you'll see in the top left, and the county growth that we're going to have. When we talk about more competitive network pricing, renegotiations were possible, and strong entry points have been a key to our growth and success. And this is something that you guys have been asking for, clients and brokers alike, is more physicians and mid-levels. So we increased our primary care access in particular, as well as our ancillary providers. 2 of our top selling markets are Florida and Texas. And I want to kind of go through some of the maps that we have for these markets. I can't go through all 23 states. That would take me a very long time. So we're going to focus on our 2 larger markets, which is Florida and Texas. And then we're going to touch on the 4 new states that we're entering. So let's take a quick look at these. These state grids that I'm going to go through, they will become available to you in Jarvis very soon. However, you are welcome to take a screenshot of these if you so desire. I also can get a copy over to your FMO so that you can access it that way. You'll see as we kind of touch on the key network providers, the right-hand corner, you can scan that QR code that gets you to the network provider directory. But in Florida, you'll see Florida has expansion into Tallahassee and Ocala markets, adding Hendry County in Cape Coral, Fort Myers, Naples market, with Hendry General Hospital as an in-network provider. Florida is a gated HMO state, but there will be some cross-border coverage. It'll be access to Baldwin and Mobile counties in Alabama. And then on the right-hand side of these maps that we'll go through, it will take you through each market and highlight the key hospital and provider systems. Obviously, this isn't all of them. It's just the key ones that we want to point out. So on the right-hand side, you are going to see A through O, starting with Cape Coral at the top and going through Orlando at the bottom. And again, you'll just see in those highlighted sections some of those key provider networks that we will have. Again, I can get you these maps. They're going to be in Jarvis as well. You can take a screenshot. I'll pause here just for a second for you to take a picture if you want to, or to go ahead and scan the QR code that's going to bring you to the provider directory.
Hey, Bobby.
Focus. Yeah.
There's a question here in the chat for you. What do you mean by gated for HMO?
Gated means that HMO, as Nick was just referring to, saying gated, you must go to your primary care before you can seek out care through a specialist.
Perfect. Thank you.
Yeah, great question. So staying in the Florida maps, we're just going to expand that now on the right-hand side through markets that are P through T. So you're going to see Palm Bay at the top, and you're going to see Tampa at the bottom. And you'll see those key provider networks that we have. And I'll pause just for a second. Again, this will all be in Jarvis, and you can scan that QR code. So that's Florida, and for 2024. Now what I want to do is kind of shift gears into Texas. Texas is going to be, and has been, a very key market for us. And what you will see is here it's a gatekeeper HMO state as well. We're going requiring that referral to see a specialist. Here, what we've done in Texas, we're expanding into 158 additional counties for 2024. I'll say that again, moving into an additional 158 counties for 2024. That will bring us to a total of 206 counties for 2024, including, you'll see Amarillo, Kylene Temple, Longview, Lubbock, Midland, Odessa, San Angelo, Sherman Denison, Texarkana, and Victoria markets. It will have some cross-border coverage into New Mexico for members in El Paso, Lubbock, and Potter counties. And then on the right-hand side, you'll see those key hospitals and provider systems going A through C. We'll go through additional markets on the next few slides, but this is to just get you through Amarillo on the top and Corpus Christi at the bottom. Now on the right-hand side, it's going to be D through L. So it's going to take you from Dallas, Fort Worth at the top, El Paso, Houston, Kylene Temple, McAllen, Laredo, and Longview. I'm going to pause just for a minute in case somebody's taking a picture of this slide. And then lastly, L through W. You'll see Lubbock at the top, going through Midland, Odessa, San Angelo, San Antonio, Sherman Denison, Texarkana, Victoria, and Wichita Falls. Key provider networks that we're trying to just illustrate to you on this slide. Another key initiative, which is new and I think very unique to United Healthcare, is a captive network featuring Kelsey-Seybold Clinic. So for any of you that are from Texas, you would be familiar with Kelsey-Seybold. This is in the Houston market. So what we're doing here is members are enrolled, who get enrolled in this plan are automatically assigned to the clinic, and they must stay within this Kelsey-Seybold network to receive coverage. So it's really just a Kelsey-Seybold network that they're staying within. A pilot for us. So I'm very excited to see how this plays out in 2024. Now let's take a look at the 4 new states that we're coming into for 2024. As I mentioned, one of them being New Jersey. It's going to be utilizing the existing New Jersey Oxford Metro network. And on the right-hand side, you're going to see the markets as well as the key hospital and provider systems. In a few weeks, they should all be in Jarvis. The second state that we're entering in for 2024 is New Mexico. Here we will have some cross-border coverage into Maricopa County in Arizona, La Plata in Colorado, if I said that right. I'm from Wisconsin, so hopefully I said that right. And then El Paso, Lubbock, and Potter counties in Texas. Right-hand side, it's going to go through those markets, specific markets, and those key provider systems. Third entry is into South Carolina. Cross-border coverage here as well into Georgia, into Augusta area, so that Richmond County. You're going to see Augusta all the way down to Myrtle Beach, the key providers. And finally, Wisconsin, my home state. So I'm excited that we're going to be here. You'll see cross-border coverage. We'll have access to Lake County in Illinois. And you're going to see the market areas that we'll be in all along that shoreline. So Appleton, Green Bay, that's where I'm close to, Janesville, and Milwaukee. Primarily in Wisconsin, we're utilizing that Aurora Hospital and Provider Systems. So here's more information on how we're expanding our pharmacy network dramatically for 2024. Our members currently only have low generic copays at Walgreens pharmacies and OptumRx. In 2024, we are expanding the low generic copays to 5 times as many pharmacies, including independent pharmacies and pharmacy chains such as Rite Aid, grocery stores like Kroger, Albertsons, and Walmart. I'm delighted that now our members can pay the same low generic copays while they're to pick up their medications while they're maybe grocery shopping at Kroger's or maybe picking up household supplies at Walmart. Product. So when we develop our products, we're always starting with the consumer in mind. Who are they? What they need? How can we offer the most compelling value to meet those needs? So our IFP demographic skewed towards the older adult females, relatively high Spanish-speaking population, and a quarter of our members prefer a language other than English. Growth here in 2023, but still feel behind the times. And so you'll see a larger opportunity to go beyond language that you'll hear about more later in the presentation. Enrollments have exceeded our expectations. Obviously, that is all due to your help, indicating our products are resonating year after year. So in plan year 2023, we've seen a shift from the silver enrollment into the bronze medal levels. So in 2022, the Value Plus product families was our highest membership. Finally, we saw remarkable selection in the Zero Gold plan offered in Texas. This is a great product that we want to make sure we can retain that membership in for 2022 or 2024. Sorry. This is just a look back on 2023. So let's just jump into what 2024 has in store for us. So excited for 2024. We are adding a 5th product family named Copay Focus. You'll see it at the very bottom here. So Copay Focus plans are designed to bring more cost predictability and cost transparency for members. Should be easy to sell as these plans will be a 0 deductible plan with primarily copay cost shares. 2023, the 0 deductible plans were only available in the silver and gold. in 2024, they will be offered across all 3 metal levels. Those copay focused is positioned to compete against that zero deductible bronze plans that was rising in popularity. So for 2024, benefit enhancements were directly based on what we heard from you and our members. I've already shared with you that new copay focus plan to kind of keep beating the drum on how important the cost is for valuable coverage. We will have low or in many cases, no cost virtual primary care on most of our plans, unlimited, zero virtual urgent care. We have more office-based labs that are $20 or less. Pharmacy is our most used benefit. So we'll have the $5 or less tier 2 generics. We're offering zero copay for insulin, as well as many diabetic related labs. And finally, we are adding in-person fitness options. This chart summarizes the many product enhancements that we're offering as we move into 2024. You're welcome to take a picture of this slide. We're proud of the loyalty we're building with you and your clients by continuing to improve our products and expanding them to meet the needs of the consumers. So thank you for the feedback that you've provided to us and the support in bringing high quality, affordable healthcare to the ACA market. So we touched on all of these new features, but again, if you wanted a quick snapshot, this is a great slide to take a picture of. So let's talk about dental and vision benefits. We're thrilled to offer plans with dental and vision benefits for both adults as well as pediatrics. So pediatric dental is embedded in all of the plans, whereas adult dental would only be available in our Silver and Gold Advantage Plus plans. So pediatric and dental and vision in all plans, and then you'll see the adult dental and vision just in the Silver and Gold Advantage Plus plans. United Healthcare is one of the few carriers that offers the embedded adult and vision plans in the majority of our markets. I want to touch on the virtual care again. So in 2022 and in 2023, many of your clients had enjoyed the membership in our Virtual First product, which featured services such as the 24/7 zero unlimited virtual and primary care. We are expecting to continue this product for 2024 with our provider partner Galileo. But in 2024, all other products will include virtual services provided by Optum Virtual Care. This will include unlimited, zero virtual urgent care on most products, as well as 24/7 care support phone triage. Access is available for members of all ages and is integrated directly with our member mobile app and website. In addition, this is one thing I'm excited about, is we've always had that digital fitness benefit. Well, we're adding access to physical gyms on our Advantage plans. So again, it's got to be the Advantage plans, and those physical gyms will be given to them through OnePass, national network name of branded gyms in our members' neighborhoods, and this will be enabled through this simple access through the member portal. We are happy to continue our $100 member incentive program for 2024. We have enhanced the program for 2024, though, to even provide more rewards by moving the gift cards from specific stores that we had in 2023 to now going to be a prepaid Visa card that can be used anywhere. We'll continue to provide 20% discount on thousands of Walgreens branded over-the-counter health and wellness products. So again, Walgreens branded over-the-counter health and wellness products will give them a 20% discount. Finally, we launched the complimentary AARP membership in 2023, offering discounts on everyday needs. Utilization surpassed expectations. In a cost-pressured environment, consumers are looking for savings and discounts discount. So we're thrilled to be able to bring this benefit back for 2024. National marketing. So the IFP value proposition is all about affordability, coverage, and support. Through our prospect and member communications, we'll promote these main messages as well as reinforce how with an IFP plan, we will be there for the times that matter the most to our members, no matter what might come in their way. So we'll continue to bring these messages to life for open enrollment and beyond through that U plus United Healthcare campaign. Hopefully you guys are all familiar with that. That is something that we successfully launched last year and resonated strongly with our prospects and members. You'll see enhanced content as we have continued to learn and optimize this campaign this year, and I'll share with you a few examples here shortly. I think, Sally, when I mentioned Advantage plans, because we do have Advantage plans in the IFP market, ACA, it does seem like I'm sounding like I'm talking about the Medicare products, but it's not. So our IFP plans, some of the plan families is called Advantage. So it's not Medicare products, it would be ACA. So all I'm talking about today is ACA products. The Hispanic opportunity, 46% of 2023 new ACA members were Hispanic. It's the largest and fastest growing minority group. All tactics and initiatives will include Hispanic moving forward. And from a marketing perspective, language is not enough. We will be culturally relevant across our full journey and touch points, including landing pages, sites, applications, and support, all in language with culturally relevant images and messaging. So this is becoming a big feature for United Healthcare to make sure we're touching those members. So as we look to see the UHC IFP value proposition with new prospects and leads for your business across our footprint, we will focus on building the UHC individual and family plan awareness and consideration. We have digital first media approach, focusing on channels like social, YouTube video, CTV, display, and search channels, as well as national PR push to drive more and more impressions in the marketplace for UHC IFP. We also know consumers have different mindsets and different barriers as they move through the shopping journey. So our content will be based on customer pain points, right? And some of the customer pain points are value and price, coverage, and the support and guidance that we can provide in maximizing the value of their plan. So here on the screen are some of the examples of the content we'll use to drive that IFP affinity with prospects in our paid channels. Operational enhancements. We have the IFP Connect newsletter. Hopefully all of you are getting that. It is sent every other Friday, so 2 times a month. This just celebrated its first year. We have close to a 50% open rate and click-through rate on the articles, which continues to surpass the industry standards. It's the right information at the right time as it pertains to the business. And something noteworthy here on the screen, which I feel like gets lost in the blue imaging, is that we now have a clickable option on the top right-hand corner to get the IFP newsletter in Spanish. I hope that you guys already signed up for the IFP text alerts. If you have not, take out your smartphone now, text IFP to 90947. Again, take out your phone, text IFP to 90947. These aren't the spam kind of texts. There's only 5 per month. We want to make sure that we're not burying you with text messages. So again, only 5 per month. It's important, and time-sensitive messages like late payment report, real-time alerts, important to your business. One of those alerts brings us to the next enhancement, and that is we've launched some new reports. So aside from the late payment report that I mentioned you would be getting through that IFP text alerts, you're going to now see the turning 65 report and turning 26 report. It's easy access to actionable information, helping with continuity of coverage when someone turns 26 and they're aging off of their parents' plan, or when they're turning 65 and aging into Medicare. I'm going to back up for just a second. So one of the questions from Brittany is how to get that text over to us. So again, when you text, in the body of the text message, you're going to just type IFP. And the phone number that you're texting to is 90947. I know that seems odd because it's not a full phone number, but the phone number that you're going to send that text message to is 90947. And in the body of that text, you're going to put IFP. So again, shared with you the late payment report, the new ones coming up, the turning 65 and turning 26. And then here's an example of how you'll be able to print or email member ID cards. So right in your Jarvis portal, you will be able to find your members and go ahead and either print their member ID card. You could take a picture of it on your smartphone and get it over to them that way, or you can actually email it to them. As far as UHC off exchange enrollments from Health Sherpa, you're going to see through Health Sherpa, the top right-hand corner is where you're going to click on the quote off X medical. Again, quote off X medical. You'll also see below that the off X dental. This is to just help make it quick and easy to sell the same brand dental plan. So if you're selling an ACA through United Healthcare, you can easily go ahead and grab a United Healthcare dental immediately through Health Sherpa. So the agent toolkit overview, we have the agent marketing toolkit, plus we also have the book of business marketing. In the agent marketing, you'll find customizable marketing tools for prospecting, collateral to educate your consumers, as well as tutorials for agent training. And in the book of business marketing, you're going to see tools and resources to stay connected with your clients, as well as to keep them educated on the plan features and benefits. Obviously, we know retaining members allows you as a broker to spend more time growing your book of business versus just working with the same clientele constantly. We would rather keep the clients happy and allow for you to grow that book of business. So located on Jarvis in that agent toolkit, it is your one-stop shop for all acquisition marketing pieces, including customizable flyers and brochures that enables you to pick and choose specific plan benefits, more social media ads. New is going to be the digital and banner ads. We have provider office window clings, materials in Spanish. And then one thing I'm excited about is the white label ad builder. This is to build agency ads without the UHC brand. You can use your own logo. As I mentioned earlier, the tutorials, use the new tutorials on Jarvis. There is one on how to use the toolkit, how to create campaigns, how to use Facebook and display ads, and so much more. So again, look for those tutorials, how to use Facebook and display ads. Agent member engagement opportunities. So you play a huge role in driving loyalty and retention through the year. So we are standing up a member communication repository of materials you can use throughout the year to support our collective members. Onboarding, you're going to see the welcome and what's new letters. This is to download or print as a takeaway for you as the agent to give at the point of sale, or you can use it as an attachment in a follow-up email to recap what they can expect in their plan. This also includes a QR code for them to watch onboarding videos. The first quarter on the plan, we've got 30, 60, 90-day content for agents to check in. 30 days, it's setupmyuhc.com registration, and it has the instructions in it, and also the 5 steps to earn their incentive. The 60-day mark is a reminder to schedule their visit with their PCP. And then that 90-day mark is to check out the benefits like One Pass, right? Those physical gyms or AARP discounts. Year round, we have benefit info-driven PDFs tailored to members for you as the agent to attach into communications through the year. Maybe things like reward reminders, One Pass, the virtual first, our Walgreens and AARP discounts. Use those to your advantage. PhD, the Producer Help Desk. This is your main point of contact. They handle contracting, sales support, application status, commissions. They can also help you with post-enrollment member escalation. This one's important. I know a lot of times brokers will want to reach out to me with some post-enrollment concerns. It is important that we use member services for that. And if there is something that is not getting resolved through member services, then you would want to touch back to the Producer Help Desk, and they will help you with that escalation support. Before we close today, let's talk quickly about ways to increase your compensation through ancillary sales. So my goal here is just to create interest in the UHC product offering. We will not go through any in-depth product trainings just due to time. So there will be questions. Feel free to reach out to me or your FMO after this session if there are any questions. But just to start off, why should we sell ancillary products? And I think Nick did a great job before I got here. This slide, number 2, is near and dear to my heart. As you know, ACA max out-of-pocket expenses are on the rise. When ACA started back in 2014, the max out-of-pocket was $6,350. Now, 10 years later, we're looking at $9,100 out-of-pocket, and this fall, it's going to almost be $9,500 max out-of-pocket. Guess what? Max out-of-pocket is not going to go down. Year after year, it's going to continue to rise. So focusing on the right hand of the slide here, you will see the average household savings is $5,300. That math does not work out, right? $5,300 average savings to this fall, almost $9,500 max out of pocket. Really what that tells me is when you place a client in a core medical plan with more than $5,300 in max out of pocket, the client can't afford it. If a client has expenses beyond their savings or liquid assets, they will likely have to use a credit card with high interest rates or potentially get into medical bankruptcy. Number 1 here touches on the plans covering expenses maybe not covered on the client's core medical plan. I know Nick talked about the networks being sometimes state-based or geographically based. And so what happens if the client goes out of network or out of state? Oftentimes, brokers are calling me asking me, Bobby Joe, what am I supposed to do when my client travels out of their home state and it's not an emergency? What plans do you have that can help? That's where the ancillary products come into play. Sometimes these ancillary products can also pay for medical services not covered by their core medical plans. I've seen some cancer medications possibly not covered on some of the plans as well. They can use these ancillary products for that purpose. Number 3, many of our ancillary products come with a lump sum cash benefit, allowing the consumer to use that cash for whatever they desire. Maybe they use it for income replacement, right? Maybe they're off work for 2 to 3 months from a severe accident or a critical illness situation. Once we give them that lump sum check, they can use that money however they see fit. And maybe it's to pay their mortgage or living expenses for those 2 months while they're off of work. And then lastly, at the very bottom of the slide, we understand cost per acquisition has increased over 200% in the last 5 years. What is cost per acquisition? That is the cost that it takes for you to get new customers in your door. whether that be through leads or marketing or outreach or etc. Many of you already have hundreds of ACA clients. Talk to those clients you already have about the ancillary products. This will help you properly insure those clients, analyzing all of the risk that you're putting on them, right? Maybe it is $9,500 out of pocket. Go ahead, properly insure them, round out their coverage with utilizing some of these ancillary plans. And guess what? It will also provide an additional stream of income for you. So use United Healthcare Ancillary for brand continuity. If you're selling ACA through United Healthcare, use United Healthcare Ancillary. Keeps the client all within the same brand. Now, being that these plans are all standalone, the client does not have to have core medical with United Healthcare. Maybe their core medical might be with a competitor. That's okay too. They can come to us just for an ancillary product. They do not have to have core medical with United Health One or United Healthcare, sorry. So what is in our ancillary portfolio? Before I say what we offer, let's first point out that each of these products, I think this was a question asked earlier, each of these products do have guarantee issue options available. As we are working with ACA clientele, this will make cross-selling ancillary easier for you and the client. So on the left-hand side, in the shaded blue, you're going to see our top 2 selling ancillary plans. That would be dental and vision. So dental, under the age of 65, there are 8 plans to choose from. The best sellers are those that don't have wait periods for preventive, basic, and major services. With the 8 different plan choices, a lot of plan flexibility, these plans can range from as low as $20 a month to as high as $50 a month. The client can pick and choose what's most important to them. Vision, this is a client win-win. The client will pay less in annualized premium than they'll get back in benefits from United Healthcare. They will win. They're going to pay United Healthcare less than they get in benefits. I can't ever say in insurance they're going to win, but I can tell you that will happen with vision. Ancillary accident and critical illness are the next on our top seller lists. So accident plans start as low as $8 a month, but can go definitely up to that $40 a month range. I suggest selling a $10,000 cash benefit to cover the client's max out of pocket on their ACA plan. That is if it's being sold with ACA, right? If ACA is $9,100 today, fall $9,500, choose that $10,000 cash benefit. It's going to cover their entire out of pocket in an accident situation. It does not have to be used with ACA because there's other core medical plans out there. So if they do choose the accident plan, it can go up to $20,000 max benefit. Critical illness, we just refreshed our portfolio last Friday, September 22nd, allowing us to go up to $100,000 benefit. However, at minimum, again, there too, I suggest a $10,000 benefit to cover the max out of pocket on their ACA plan, if that is what their core medical plan is. These plans can be very inexpensive. We do have a product that has both accident and critical illness in one. So a 40-year-old male, for example, choosing a $10,000 accident and $10,000 critical illness in one plan is around $14 a month. That's very inexpensive to cover their total out of pocket on their ACA plan. Now on the far right-hand side, you'll have hospital indemnity and our non-insurance solutions such as telemedicine. So the hospital indemnity plans pay out cash for hospital-related expenses. And we also offer telemedicine for those who don't have the benefit already included in their core medical plan. I understand some of the core medical plans, ACA or non-ACA, may already have teledoc embedded in them, but we do have that as an option. Now, not on the slide today, we also offer term life insurance, short-term medical, tri-term medical, and then last Friday, September 22nd, we launched a brand new hospital indemnity plan, but that's only in the senior market space. So just to point out the need, the statistics speak for themselves. As you can see, 76.5 million Americans do not have dental insurance, and 93 million adults are at risk for serious vision loss. Both of these markets are grossly underserved. Be sure to protect your clients with dental and vision coverage. It's a nice value add, and the products are commissionable. The other products we talked about, accident, critical illness, and hospital indemnity. There's the need here too. Over 40% probability for men to be diagnosed with invasive cancer. This one is scary to me. Every 40 seconds, an American has a heart attack. Every 40 seconds. I think the statistic with strokes is like 39 seconds. So every 39 seconds, an American has a stroke. The average hospital stay is over $10,000 with almost 36 million hospitalizations a year. Accident, critical illness, and hospital indemnity plans are outstanding solutions to mitigate the financial risks that any consumer might face from an unexpected accident or critical illness situation. And again, they are commissionable. So lastly, to sell these products, it's important to understand that this is not part of the UHC IFP contract. A separate appointment is necessary with United Health One, otherwise known as United Healthcare Golden Rule. So if you are contracted, please visit your broker portal today to do some quoting. www.uhone.com/broker. You'll start seeing some of our ancillary products on some other quote and enrollment platforms. If you are not contracted, please contact your FMO today and they can help you get that contracting link. So in closing today, on behalf of United Healthcare, I want to thank you for taking time out of your day to be here with me and wish you sales success in this open enrollment and beyond.